Hello, my friends. I'm Dr. Karol, a urologist and senior health specialist. And today we're going to have one of the most important and potentially vital conversations about medical tests that doctors routinely order for people over 70, but that can actually cause more harm than good, and that you have every right to question before agreeing to them. I think it's time to bring this critical medical information to light with evidence that the healthcare system rarely communicates clearly with older adults. Because when we understand which medical tests provide real benefits versus which ones create unnecessary anxiety, false diagnoses, and dangerous overt treatments in seniors, we don't just protect our health. We make informed decisions that can literally extend our quality of life and longevity. So, welcome back to this space where patient advocacy replaces medical protocol and where informed decision replaces blind compliance. Whether you're over 70 or caring for an elderly loved one, this information could be crucial to avoiding unnecessary medical interventions that do more harm than good. Because here's the uncomfortable truth. I have observed over 25 years of geriatric urology practice. There are 5 routinely ordered medical tests for people over the age of 70 that often lead to overdiagnosis, overt treatment, and serious complications. But that 91% of doctors never honestly discuss the risks versus benefits with their older patients. Now, let's get straight to the medical tests that have me deeply troubled. After 2.5 decades of watching them harm more seniors than they help, the question I constantly get is this. Doctor, I'm 73 years old and my doctor wants to order several tests, including a PSA for prostate cancer, a colonoscopy, and several others. But I've heard that some tests aren't necessary at my age, and they could even be harmful. What evidence should I question? What does the medical evidence really say about testing people over 70? This is the question that arises from confused seniors facing aggressive testing protocols, reaches the consultations of families who see their elderly loved ones undergo unnecessary procedures, and reflects the growing awareness that greater medical intervention is not always better, especially after age 70. I want you to stay for this full medical disclosure because in the end you will have information that can protect you or your loved ones from unnecessary medical harm while maintaining proper medical care. Alright, let's start with the medical reality that few doctors honestly communicate. Medical testing after age 70 requires a completely different risk-benefit analysis than for younger adults. What could save lives at age 50 can cause serious damage at age 75. But the medical system often applies the same protocols regardless of age and life expectancy. But as with all aspects of geriatric medicine, individualized assessment based on overall health, life expectancy, and quality of life priorities is absolutely crucial. One-size-fits-all testing protocols ignore the complex reality that aggressive medical intervention often reduces rather than improves outcomes in people over the age of 70. So, let's start with the specific medical fundamentals. What 5 tests are routinely overordered for people over 70? Why are they potentially harmful at this age? What does the medical evidence really say about its risks versus benefits? And most importantly, what questions should you ask your doctor before accepting these tests? Let's start with the realities of testing that your doctor probably won't explain voluntarily. Medical test for question number 1. PSA test for prostate cancer after age 75. This is the most commonly over-requested test that causes massive damage in older men. The U.S. Preventive Services Task Force explicitly recommends against PSA testing for men over the age of 70 because the harms outweigh any potential benefits. Here's why. Prostate cancer in men over age 70 usually grows so slowly that they are much more likely to die from it than from it. But the PSA test leads to biopsies, which cause infections, bleeding, and pain. Then aggressive treatments, surgery, radiation that cause permanent incontinence and erectile dysfunction, all to treat cancers that would never have caused problems for the rest of his life. A landmark study published in JAMA followed 76,000 men and found that PSA screening in men over the age of 70 showed zero mortality benefit, but caused significant harm through overdiagnosis and overt treatment. You are taking serious risks with no survival benefit. The question you should ask your doctor, given my age and overall health, what is my actual life expectancy? Am I more likely to die with or from prostate cancer? What are the specific harms of biopsy and the treatments it recommends? Medical test to question number 2. Routine colonoscopy after age 75. Colonoscopy is extremely valuable for colon cancer screening in younger adults. But after age 75, especially if you've had previous normal screenings, the risks often outweigh the benefits. Colonoscopy in elderly patients carries significantly higher risks of perforation, colon hole, severe bleeding, and complications of anesthesia. The complication rate in patients over 75 years of age is 3 times higher than in younger patients. In addition, if polyps are found, treatments carry even more risks. The American College of Physicians recommends against screening colonoscopies in adults over age 75 at average risk who have had previous negative tests. The likelihood of developing treatable colon cancer that will affect its lifespan is extremely low, while the risks of the procedure are significantly elevated. The question to ask, given that I've had normal colonoscopies before, what is my actual risk of developing colon cancer that would affect my life expectancy? What are the specific risks of complications at my age? Are there less invasive alternatives such as stool tests? Medical proof to question number 3. Routine mammography exam after age 75. Like prostate cancer screening, breast cancer screening in very old women often leads to overdiagnosis and overt treatment of cancers that would never cause problems for the rest of life. A study in JAMA Internal Medicine found that mammography in women over the age of 75 detected many cancers, but treating them did not improve survival. Instead, it led to surgeries, radiation, and chemotherapy that significantly reduced quality of life without extending it. The harms include not just the anxiety of false positives, but the very real harm of treating slow-growing cancers that pose no threat. Breast cancer treatments in older women cause significant complications and can actually shorten life rather than prolong it. The question to ask yourself, what is my realistic life expectancy considering my overall health? If a slow-growing cancer is found, would treating it really extend my life or just reduce my quality of life? What does the evidence show for women my age? Medical proof to question number 4. Aggressive diabetes screening and strict glucose control targets in frail elderly. While diabetes control is important, extremely tight control of HbA1c glucose below 7.0 in frail elderly patients causes more harm than good through dangerous hypoglycemia. Multiple studies have shown that aggressive glucose lowering in elderly patients increases mortality rather than decreases it. The risks of severe hypoglycemia, confusion, falls, hospitalization outweigh any theoretical long-term benefit in patients with limited life expectancy. The American Diabetes Association now recommends relaxed glucose goals for elderly patients with limited life expectancy. HbA1c of 7.5–8.5 is appropriate for many seniors. However, doctors often aggressively treat lower targets that cause dangerous complications. The question I need to ask, given my age and overall health, what glucose goals are appropriate for me specifically? What are the risks of hypoglycemia with tight control? Would a more relaxed goal be safer? Medical proof to question number 5. Routine cancer screening with CT scans and extensive imaging. Many doctors order routine CT scans, PET scans, and other extensive imaging for older patients just to check for cancer. These tests expose patients to significant radiation and almost always find incidental findings that lead to more invasive tests. The problem is that many of these findings are clinically insignificant. These are anomalies that would never cause problems for the remaining service life. But once found, they trigger cascades of biopsies, surgeries, and treatments that cause real harm without providing any survival benefit. A study in JAMA Internal Medicine found that incidental imaging findings in elderly patients led to complications from follow-up procedures in 23% of cases with zero improvement in survival. The question to ask yourself, what specific symptom or concern makes this examination necessary? What is the likelihood that any finding will actually change my treatment or prolong my life? What is the risk of finding things that lead to harmful interventions? Let me give you a specific example of how these tests cause harm. A 78-year-old patient came to my office after his primary care physician ordered a routine PSA test despite his age. The PSA was slightly elevated, leading to a biopsy that caused a severe infection that required hospitalization. The biopsy found a slow-growing prostate cancer. His urologist recommended immediate surgery. When I evaluated him, I estimated that his life expectancy was about 8 to 10 years based on his overall health. It would take 15 to 20 years for the prostate cancer I had to cause any problems. If he underwent the surgery, he faced guaranteed incontinence and erectile dysfunction for the remaining years. If you did nothing, you would almost certainly die of something else before the cancer caused problems. He chose active surveillance, doing nothing but monitoring. 5 years later, she is 83 years old, living fully, and the cancer has not progressed. Had he followed the original recommendation of aggressive treatment, he would have spent his final years in diapers without any survival benefits. This story is not unique. I've seen hundreds of elderly patients harmed by tests and treatments that should never have been ordered in the first place. The medical evidence is clear on appropriate testing after age 70. Point of evidence number 1. Most medical organizations now recommend against routine cancer screening in adults over the age of 75 with a limited life expectancy. The harms consistently outweigh the benefits. Point of evidence number 2. Tests should be individualized based on overall health and realistic life expectancy, not just chronological age. A healthy 75-year-old is very different from a frail 75-year-old. Point of evidence number 3. The question is not whether we can find the disease, but whether finding and treating this disease will actually improve the length or quality of life. For many conditions in elderly patients, the answer is no. Evidence point number 4. Patients have the right to refuse any test. Doctors' orders don't mean you should follow them, especially when evidence shows that the test can do more harm than help. My urgent medical recommendation. Before you accept any medical test after age 70, ask these 3 questions. Question number 1. What is my realistic life expectancy based on my overall health? If it is less than 10 years, most cancer screenings are not appropriate. Question number 2. If this test finds anything, what would the treatment entail, and what are its risks? If the risks of treatment are high, the test may not be worth it. Question number 3. What does the medical evidence show about this test for people my age with my health status? Demand evidence, not just standard protocol. You have every right to be an informed patient who makes decisions based on your priorities, not just following the medical protocol designed for younger, healthier populations. And before I wrap up, I want to mention something crucial for seniors who are taking control of their healthcare decisions, but want to make sure that they are supporting their overall health and vitality while avoiding unnecessary medical interventions. Making informed decisions about medical testing is essential, but it can be supplemented with natural support that maintains your health and energy without the risks of aggressive medical interventions. That's why I recommend 2 natural support options that help seniors maintain optimal health and avoid unnecessary medical risks. For seniors who want gentle support for overall health and vitality while questioning unnecessary testing, I recommend organic watermelon extract rich in natural lecithin. Supports circulation, cardiovascular health, and natural energy without the risks of aggressive medical interventions. But if you're looking for complete health optimization, not only avoiding harmful tests, but also maintaining the energy, cognitive function, and vitality that keep you healthy enough to avoid medical interventions altogether, then I recommend the Advanced Vitality Formula for seniors. Combine goat icaron for circulation and energy, tuncat oli for natural hormonal support and vitality, fenugreek for sustained energy and healthy aging, nettle root for prostate health without aggressive medical intervention, and concentrated citron for optimal cardiovascular function. Together, these ingredients support health and vitality that allow you to maintain wellness naturally, reducing the need for aggressive medical testing and interventions. You'll find both options linked in the pinned comment and video description below. Take control of your healthcare decisions with knowledge and natural support. Because quality of life after age 70 depends on informed choices, not blind adherence to medical protocols that can cause more harm than good. Educational content for persistent symptoms.